Hello everyone, welcome back to my class. Okay, today's chapter is chapter 9 from our class and chapter 14 from the book. And today's topic is on healthcare associated infections, previously known as nosocomial infections. And learning outcome or learning objectives for today's chapter is to explain how healthcare associated infections they differ from other infections, to describe the factors that influence the development of healthcare associated infections, as well as to describe the three types of healthcare associated infections and how they may be prevented. Of special concern for the epidemiologists and other healthcare workers are healthcare associated infections and diseases, which were formerly called, as I mentioned, nosocomial infections or nosocomial disease. So healthcare associated infections, abbreviated to as HAIS, are infections acquired by patients or healthcare workers while they are in hospital care facilities, including hospitals, dental offices, nursing homes, and other doctor waiting rooms. According to Center for Disease Control, CDC, it has estimated that about 10% of American patients acquire HAIS every year. And healthcare associated disease increase the duration as well as cost of medical care and result in some of 100,000 deaths of American people annually. When most people think that HAIS, what likely comes to mind are exogenous HAIS, which are caused by pathogens acquired from the healthcare environment. After all, hospitals are filled with sick people, shedding pathogens from every type of portal of entry. However, we have seen that members of the nosocomial microbiota can become opportunistic pathogens as a result of hospitalization or medical treatment such as chemotherapy. Such opportunistic pathogens cause endogenous HAIS, which means they arise from normal microbiota within the patient that become pathogenic because of factors within the healthcare settings. Iatrogenic infections literally mean doctor-induced infections, and they are a subset of HAIS that ironically are the direct result of modern medical procedures such as the use of catheters, invasive diagnostic procedures, as well as the surgery. When it comes to superinfections may result from the use of antimicrobial drugs that by inhibiting some resident microbiota, they allow others to thrive in the absence of this type of competition. Like for instance, long-term antimicrobial therapy to inhibit a bacterial infection may allow Clostridium difficile, which is a transient microbiota of the colon, to grow excessively and cause a painful condition which we call as pseudomembrane colitis. Such superinfections are not limited to healthcare settings only. So healthcare associated infections most often occur in urinary, respiratory, cardiovascular, as well as intragumentary systems, though surgical wound can become infected and result in healthcare associated infections in any part of the body. HAIS arise from the interactions of several factors in the healthcare environment, which include the three factors which you see here in this diagram. So we start with the first one, which is exposure to the numerous pathogens which are present in the healthcare settings, including many that are resistant to antimicrobial agents. Second one is the weakened immune systems or immunocompromised patients who are ill, making them more susceptible to opportunistic pathogens. And the third one is the transmission of pathogens among the patients and healthcare workers from one staff to the visitor, to the patient, and even from one patient to another via different activities of staff members. And this one includes invasive procedures and other iatrogenic factors. So although haze can result from any one of the factors shown, most are the product of interaction of all of the three factors. Aggressive control measures can noticeably reduce the incidence of haze. And these factors include disinfection, medical asepsis, including good housekeeping, hand washing, bathing, sanitary handling of food, proper hygiene, and precautionary measures to avoid the spread of pathogens among the patients. Surgical procedures or surgical asepsis and sterile procedures, which include thorough cleansing of surgical film, use of sterile instruments, and the use of sterile gloves, gowns, caps, and masks, isolation of particularly contagious or susceptible patients, and the most important one, establishment of a healthcare-associated infection control committee charged with surveillance of nosocomial disease, and review of nosocomial control measures. So numerous studies have shown that the single most effective way to reduce haze is effective hand washing by all medical as well as supporting staff. In another study, deaths from haze were reduced by over 50% when hospital personnel followed strict guidelines on washing their hands frequently. So with this, we end today's chapter, and I thank you very much everyone for watching. And should you have any questions, please feel free to leave your comments under the video here, and don't forget to subscribe to my channel. Thank you very much.